Southeast Radio's Business Matters with Carl Fitzpatrick.
Southeast Radio.
Well, Southeast-based RelateCare recently announced that it was creating 280 new jobs. As part of the Arcasas Group, which includes Waterford-based Rigney Dolphin, RelateCare has developed tailored patient access and engagement solutions for healthcare providers in the US. Conor O'Byrne, the CEO of RelateCare, joins us now to discuss this expansion. Conor, start by providing us with an insight into your own background.
Yeah, thanks, Carol. So I actually graduated in 2000, went to WIT, started studying business. And whilst I was in WIT, I took on a part-time job in a company called Rigney Dolphin. And this was basically a customer service role. We were supporting different telco clients. And I remember working on Vodafone customer service support line on behalf of Rigney Dolphin, and kind of progressed through college, but never left Rigney Dolphin and actually got promoted. So I've been actually part of the same group of companies now for over 20 years, and eventually became the Connected Health Director for Rigney Dolphin. So this is when we were identifying healthcare opportunities back in 2007, 2008. And beyond that, I travelled to Cleveland to work on a big contract for us at the time with the Cleveland Clinic. And when we launched our joint venture company, RelateCare, I became the CEO of RelateCare and have been the CEO ever since.
So talk to us about Arcasas Group, its scale and the geographical locations in which it has a presence now.
Arcasas is essentially the holding company for both RelateCare and Rigney Dolphin. The group has 1,400 employees. 1,100 of those employees are based in Ireland, with the remaining 300 employees based in the US. We have a physical footprint here in Waterford. I'm actually sitting here in Waterford this morning, although I do quite extensive travel, I suppose, especially to the US. We've just opened up a regional hub in Tralee. We were in the news a couple of weeks ago about that expansion. And then in the US, we have physical offices in Cleveland, Ohio, and are about to put down physical offices in Little Rock, Arkansas as well. But we would have employees essentially in every county in Ireland, and we would have employees across 22 different states in the US.
And in November 2009, Rigney Dolphin started working with the Cleveland Clinic and formed a joint venture in 2013. How did this partnership actually come about, Conor?
Yeah, so for anyone that doesn't really understand the Cleveland Clinic, it's just a mega organisation in terms of healthcare, one of the leading kind of healthcare brands in the world. In fact, it's been the number one heart hospital in the world for nearly 30 years. So we got an initial introduction through Enterprise Ireland. There was a delegation over from the Cleveland Clinic back in 2009, and we basically had a meeting in Dublin. That meeting led to subsequent meetings, and in November 2009, I found myself with some other colleagues, I suppose, travelling to Cleveland to visit the Cleveland Clinic and to start a project where we were carrying out a current state assessment, looking at all of the different parts of the Cleveland Clinic that were managing patient interactions, and essentially back in 2009, primarily telephonic interactions with patients. And obviously, given Rigney Dolphin's background and history in customer service and contact centre, Cleveland were attracted to Rigney Dolphin at the time in relation to the work that we could do.
So what was the pain point that Cleveland were having at the time?
There was over 800 individual employees that were managing patient interactions over the telephone. And it was organised and managed in a very non-uniform way. So this kind of led to, various inefficiencies and various, I suppose, opportunities for patient experiences to be poor and, less than optimized. So what we brought, I suppose, at the time in a kind of consultative initiative was the ability to bring all of those resources together and to create, I suppose, a standard target operating model, and created a new centralized access to care division within Cleveland Clinic.
I actually remember covering the story back in 2013, and from memory, one of the challenges that Cleveland were having was that when patients were being discharged from hospital, they wanted to make sure that they weren't coming back in again. So an awful lot of the support that you were providing was checking in with patients to ensure that they were taking their medication. Is that some of the work that you've been doing since?
That's a program that actually continues today with the Cleveland Clinic. And, originally driven, I suppose, in the US back in 2013, the Center for Medicare and Medicaid Services started to introduce penalties for readmission. So when we, contrast that, I suppose, to, what happens kind of mostly here in Ireland, it was very kind of innovative and very kind of forward in terms of its thinking. So it does force hospitals to start thinking about the continuity of care when the patient leaves the hospital. And it really is connecting with the patient post-discharge, checking in on, worsening symptoms or red flags, but also re-educating those patients on their medications. And about a third of all avoidable readmissions happen as a result of non-compliance with medication.
So talk to us about how this joint venture has developed since 2013.
Thankfully, I suppose, and through, the dedicated and really the Trojan work of a great team over the years, but we've expanded quite rapidly, I suppose. We started off with a handful of employees in the beginning and mainly working on consulting initiatives. So kind of going into organizations and in many ways, sometimes replicating what we had already achieved in the Cleveland Clinic. Over the years, the interest in RelateCare providing additional support to these organizations, hasn't increased. So, many of these organizations are now relying on RelateCare to kind of manage in RelateCare's facilities or virtually a number of the tasks or activities along that patient journey, whether it's, pre-hospital visit or pre-hospitalization or post-discharge, as we've just spoken about. So, we've seen the demand for outsourcing support really, really increase over the last number of years, and especially over the last couple of years as we have, gone through the pandemic.
Beyond providing post-discharge support, what other services are you now providing?
Yeah, so we think about the beginning of the patient journey. At the beginning of the patient journey, it's generally patient registration. So, we would start off with patient registration right through to appointment scheduling. Post the appointment is scheduled, what happens in the US is the insurance companies must verify that the patient has the right insurance. So we're also now involved in insurance verification and seeking prior authorizations for procedures. Okay, so it kind of goes all the way along that patient journey as the patient comes into the hospital. And then on the post-discharge side, then, we are managing the post-discharge follow-up we spoke a little bit about earlier on, but also we've quite an extensive nurse triage team that is providing triage support for patients who have questions and also who may need support or information as they continue their recovery. And I suppose what the future holds is, we're looking to expand into areas like remote patient monitoring. So that's kind of an area where we have an existing infrastructure, we have an existing workforce that can support remote patient monitoring. So we're looking at opportunities in those areas.
And just on the topic of that, Conor, we are emerging from a transformative 2-year period for many businesses. But how did the pandemic change the way in which healthcare organisations communicate with their patients?
Yes, so a huge shift for healthcare organisations. During the height of the pandemic, there was a huge shift to virtual visits. And volumes of virtual visits as an overall representation of, appointments kind of shifted from, single digit numbers in terms of virtual visits right through to, some of the organizations we work with during the height of the pandemic were managing about 70% of their hospital appointments were being managed through, virtual appointments. What it has kind of meant for us is like we've had to shift, 95% of our workforce back in, March 2019, shift that workforce, I suppose, back during the beginning of the pandemic to work in a kind of a virtual model. Patients probably have gotten more used to now interacting with organizations in a new way, in a different way. And there's certainly much more willingness and openness, I suppose, to virtually communicate, with their healthcare provider than, what we would have seen before.
And how supportive has Enterprise Ireland been to RelateCare to date?
Enterprise Ireland has been a great support to RelateCare. They've really been with us kind of along the journey. We worked very, very closely with the teams that are here in Ireland. But also, we've worked extensively with the Boston Life Sciences office. And, we built up a great partnership with a lady called Doreen McKeown over the years. And she has kind of moved back to Ireland in an Enterprise Ireland role. But we continue that kind of relationship and that, collaboration, I suppose, with Enterprise Ireland in the US. And, we create, I suppose, not only opportunities for ourselves through that collaboration, but also opportunities for Enterprise Ireland and indeed other Enterprise Ireland companies.
And of course, RelateCare recently announced 280 new jobs for Tralee. Now, the company itself and of course its founding company, Rigney Dolphin, have always been synonymous with Waterford. So why are these jobs going to Tralee?
Yeah, so I suppose the first thing to say is, we have now employees, because of our virtual working model, we would now have employees across every county in Ireland. And, in the southeast, we would have in the region of 700 employees between Waterford, Wexford, Kilkenny. So, still a huge commitment to the southeast and, to other parts of Ireland. We were looking, I suppose, to expand, our kind of regional footprint, and it's part of our overall corporate strategy over the next few years that we would expand in a way where we would have kind of a hub and spoke model, which, we still retain our Waterford headquarters, but then also expand hubs into different parts of Ireland. So, we visited a number of different locations, and look, we could have went anywhere, Carol, really, but we decided on Tralee in the end, and it has good access to, the infrastructure is very, very good down there. There is a great employment catchment area in the region, and of course, the Munster Technological University.
So in terms of the importance of MTU, Conor, how will you be engaging with the Munster Technological University and how will you be looking for them to support you going forward?
Yeah, so the Munster Technological University is an important factor, I suppose, in the decision to go to Tralee. They have plenty of different schools, I suppose, within the university and different courses and modules that could be supportive to the direction, I suppose, RelateCare is going in, including the School of Nursing. And like the Southeast Technological University, there are opportunities to collaborate, locally with those organisations, develop modules, talk to their, I suppose, experts in the field and, also tap in, I suppose, to a student population that can kind of help our organisation grow. So we have the opportunity to give employment, but we also have the opportunity to innovate and collaborate with these organisations as we try and solve, I suppose, some of the newer problems that now exist in healthcare.
And going forward, Conor, what would it take for County Wexford to get some of these jobs?
We have a fair amount of employees in Wexford County. I'm a fan of Wexford myself from being from the southeast. I've spent plenty of time in Wexford over the years, and I'm aware, I suppose, of different developments that are going on, not only in Wexford town, but also kind of across kind of some of the other kind of major towns. I actually got married in Wexford, so I might have a soft spot for Wexford myself.
Talk to us about these roles, these 280 jobs that you're creating in Tralee. What will you be looking for in terms of skill sets there?
In the beginning, probably the focus right now is on the majority of the roles will be what we would call kind of frontline roles. So, the roles that really, the employees, the workforce that's interacting directly with the patients. So we have a range of different kind of roles there, including, patient scheduling representatives, prior auth representatives. We hope to kind of evolve those frontline roles into kind of more advanced either healthcare assistant roles, or indeed in the future, there's a strong possibility that we may require registered nurse roles. Supporting the frontline roles, then we would have the managerial and support roles. So we have openings across kind of the management teams, team leader level, supervisor level, more senior operational manager level. And then from a support role point of view, we have dedicated support teams across training, quality, IT. So there's kind of a whole range of different roles at the moment. But, we have kind of recruited our first batch of 30 employees. We got the opportunity to meet some of those employees last week and indeed over the last kind of several weeks. And, we're looking forward, I suppose, to kind of expanding in the Tralee region. But at the same time, we're also, recruiting kind of across the southeast as well, and there's plenty of opportunities for people there too.
Conor, there's no doubting that RelateCare has been a great success story here for the southeast, and as I say, remember covering the story back in 2013 when you actually announced the joint venture with Cleveland Clinic. But looking ahead, what are the future growth plans for the company?
Yeah, so there's a huge demand for the for the types of services that we can provide right now, and there's a universal staffing challenge, I suppose, not only in healthcare, but across many different industries. So, the time is, kind of ripe, I suppose, for organizations like RelateCare to try and grow their businesses. We want to do it in a very meaningful and sustainable way. This isn't about kind of a race to the top in terms of, growing kind of into a mega company. We spent a lot of time over the last kind of 12 to 18 months building up our executive team, bringing kind of, new talent into the business. And, we want to make a difference as well. We have a slogan, I suppose, internally that says every interaction matters. And that can be, one of our team talking to a patient, to kind of internal employees engaging with each other. So we want to make a difference. We want to be one of the leading organizations, I suppose, that's providing the types of services that we provide back into, the hospitals that we work with. And there's something kind of special about working in healthcare. It's very, very rewarding. And, you don't need to be a doctor or a nurse that potentially is saving a life. These interactions, these conversations that, our staff are having with people, are really helping those people on a daily basis, and getting them the access into the healthcare that they need. So look, we want to continue our growth path. We have some ambition, I suppose, to expand into other countries. We'd love to bring back more of the innovation and more ways of working that we see working successfully in the US, mainly back into countries like Ireland, and I think there's a big opportunity to do that. And, we want, as I said to you, we want to provide a quality of service, I suppose, that we're renowned for.
Well, if you've just tuned in, that was Conor O'Byrne from RelateCare, and I'd like to thank Conor for sharing this Southeast success story with us this morning.
Southeast Radio's Business Matters with Carl Fitzpatrick.
Southeast.